How is bile acid malabsorption diagnosed? Have you ever wondered how doctors figure out if someone has bile acid malabsorption? This condition can lead to uncomfortable symptoms like watery diarrhea and urgency. It's especially common in people with sensitive stomachs, irritable bowel syndrome with diarrhea, and colitis. Understanding how this diagnosis works can help many find relief. Bile acid malabsorption happens when bile acids are not absorbed properly in the terminal ileum. This leads to excess bile acids entering the colon, causing irritation and symptoms. To diagnose this condition, doctors use several methods to check bile acid levels and their effects on the body. One of the main tests is the 75 selenium 75 labeled haematorocholic acid test. This test is the gold standard in many countries outside the United States. It involves taking a radioactive bile acid analog and measuring how much is retained in the body after 7 days. If retention is low, it indicates bile acid malabsorption. However, this test is not widely available in the U.S. and involves some radiation exposure. Another common method is the fecal bile acid test. For this test, patients collect stool samples over 48 hours while following a controlled high-fat diet. This helps measure the total and individual bile acids in the stool, providing a clear picture of bile acid loss. It's particularly useful for those with chronic diarrhea due to irritable bowel syndrome with diarrhea or colitis. Blood tests can also play a role in diagnosis. Serum levels of 7-alpha-hydroxy-4-cholesterol 3-1 can indicate bile acid synthesis. Elevated levels suggest increased bile acid production due to malabsorption. This test is less invasive and requires fasting. It has good sensitivity but may not be as specific as other tests. Another blood marker, fibroblast growth factor 19, is still being researched. For individuals with sensitive stomachs, irritable bowel syndrome, or colitis, testing for bile acid malabsorption is important, especially when chronic diarrhea persists despite standard treatments. Doctors often start by ruling out other causes like inflammatory bowel disease or infections. The fecal bile acid test is particularly relevant for those experiencing chronic diarrhea. It directly measures bile acid loss, helping to tailor treatments such as bile acid-binding medications that can reduce symptoms. Blood tests can be a convenient first step but may need confirmation with stool testing. Patients should be aware of the preparation needed for stool collection tests, including dietary fat intake. Availability of tests can vary by region. In the United States, fecal bile acid measurement and serum tests are more accessible than the 75 selenium 75 labeled haematorocholic acid scan. Accurate diagnosis of bile acid malabsorption can prevent mislabeling symptoms as just irritable bowel syndrome. It can lead to effective treatments that improve quality of life for those with sensitive digestive systems. Understanding these diagnostic methods can help individuals seek the right tests and find relief from their symptoms.